Hi, I'm Trendon Napier, and this is Lauren. She's going to be my patient today. Do you care if you're in this video for educational purposes?
It's fine.
Okay, awesome. So I'm Trendon. I'm going to be your student physical therapist today. And do you care if I check your name band right quick around your wrist?
Mm-hmm.
Okay, just want to make sure I'm in the right place. And do you care to go ahead and confirm your name and date of birth for me?
Lauren Smith, 4/11/2000.
Okay, awesome. So I just want to take your blood pressure measurements today. That's why I'm here. And while you're lying down, sitting, and standing up. So I noticed in your chart that you've been on bed rest for 3 days, and also that you're on blood pressure medication. So when you're on bed rest for an extended period of time, like you have been, your body can begin to dehydrate, and with that, your blood volume within your body begins to decrease, which can cause changes in your blood pressure and make you a risk for falling. So, and as well with your blood pressure medication, it can alter your body's ability to regulate your blood pressure while you're moving into different positions. So I just want to check throughout these different positions to make sure you're safe while we're moving you and while you're just moving around in general, okay? Is that fine with you?
Yeah.
All right. So I just want to start off by checking your heart rate. Prop your arm up. Okay. So I'm going to check for 15 seconds and multiply by 4, but clinically I would do 30 seconds and multiply by 2. Okay, so I got 15, so multiplied by 4 would be 60. So that's within the normal limits of 60 to 100. Now what I want to do is just go ahead and place this blood pressure cuff on you, okay? Okay. And before taking any of these measurements in supine, I would want to ensure that my patient was here for 5 minutes before doing any of those measurements. Okay, and make sure we have this right cuff size on there. It's fitting her good. And I'm going to first perform radial obliteration. Place this here. So I'll be pumping the cuff up until her radial pulse occludes. And then I will gauge that and add 20 to 30 milligrams of mercury when I'm taking her blood pressure. I will pump the cuff up to that. So I'm going to go ahead and palpate the radial artery. Okay, I got 115, so when I take her blood pressure here in a moment, I would add 20 or 30 to that, so 135 or 145. Okay, and I would wait a minute between radial obliteration and taking the actual blood pressure measurement. But I'm going to go ahead and get into that now. You feeling okay still?
Mm-hmm.
Okay. I'll place the stethoscope on her brachial artery. Okay, I got 108/70, which is within normal limits. And so the ranges for orthostatic hypotension when changing positions will be a drop in systolic blood pressure of 20 millimeters of mercury, or a drop of 10 millimeters of mercury in diastolic. For the heart rate, a change of an increase of 30 to 40 beats per minute upon changing positions will also indicate orthostatic hypotension. So I'm going to go ahead and get her moved in the seating. Okay. okay still?
Yeah.
All right, I'm gonna get you sitting up here and leave that blood pressure cuff on you.
Okay.
So I'm gonna assist you here as you're sitting up. I'm gonna be swinging your legs off and helping you rise up. And I just want you to be mindful of your wire here.
Okay.
And let's not put any tension on that, okay?
Okay.
So you can just raise up as much as you can. I'm gonna help you swing around. Perfect. Watch your wire. All right, you feel okay?
Yeah.
Okay. So between measurements, between position changes, I would wait 1 to 2 minutes to check her vitals again. And also, I'll be assessing during this time her symptoms. So that'll be dizziness, lightheadedness, any change in color, or chest pains. So you doing okay still?
Yeah.
Okay. So now I wouldn't turn away from my patient, but just for the video purposes, I'm going to turn and look at the camera. So I'm going to get the gate belt on you just for both of our safety.
Okay.
Okay.
Yeah.
Alright, let's go ahead and check your heart rate. Let's see. I'm going to place this box under her feet just so that her ankles, knees, and hips are all at 90 degrees. Just place your hand here for me. Okay, I got 16, so multiply by 4 is 64. So that's within normal limits. We're gonna go ahead and check your blood pressure again, okay?
Okay.
Take your arm here. This is the brachial artery. Okay, I got 106 over 68, which is within normal limits as well. Okay, so now we're going to get you standing, okay, for this last measurement. So I'm going to move this. I'm going to make sure to guard my patient here. I'm just going to move the camera for video purposes. All right, we're going to get you standing, okay? So I want you to scoot out to where your feet are touching the floor there, and we're going to watch your line and make sure we don't get any tension. And on the count of 3, we're going to stand up, okay?
Okay.
So, ready?
Mm-hmm.
1, 2, 3. Feeling okay?
Yep.
Again, just assessing for any dizziness or lightheadedness or a change in color. And we're going to get these measurements one last time. So I'm going to check your heart rate.
Okay.
Okay, so I got 20 multiplied by 4 is 80, and that's also within normal limits. I'm going to check your blood pressure. You still feeling okay?
Mm-hmm.
Okay, I'm going to get her arm at heart level. Okay, so I got 102 over 80 that time. So you feeling good still?
Mm-hmm.
Okay, thank you today for your help. And I noted no changes or no orthostatic hypotension due to the blood pressure changes, which were all within normal limits. And the heart rate was also within normal limits for all the measurements.